Nicole, welcome to the show again.
Thank you. Thanks for having me, Leonie.
Yeah, absolutely. We really appreciate you taking the time to be here with us. And for those of you who haven't listened to our last episode with Nicole, dial back 1 week and you will find it. We spoke a lot about pregnancy, conception, and a lot of the challenges that you, our audience, have had around, your journeys and at my experience personally. And then Nicole was able to provide so much great context around, where to go to normalize our experiences as well and point us in the right direction if we are needing that further support. So to introduce Nicole, Dr. Nicole Highet is the founder and executive director of COPE, which has a mission to raise awareness, reduce stigma and empower families facing perinatal mental health challenges. And Nicole's also a doctor of psychology. So today what I'd love to do is bring a few more audience questions to the table, Nicole. And thank you to those listening for everyone who wrote in your questions. We had many and I've tried to choose the ones that I feel might be most relevant to most people's experiences. So I actually want to start with my own questions. So once I'd had my baby, and I think this is what a lot of my friends have said as well, there's initially, so I experienced prenatal depression, which I've spoken to in the previous episode, and I was feeling just this blanket of just numbness and not much emotion or anything like that. As soon as I had my baby, I experienced just euphoria. Like all of a sudden, like the chemicals are moving and I'm so elated and happy. And then came engorged breasts and I couldn't feed well and the baby wasn't latching. My boobs were burning and I had ice packs on my boobs and then they had other things, and then I had a episiotomy, so I had like pads in and the ice packs up there as well. And then, I was struggling with sleep deprivation and all the things. Like obviously that elation of having a child was absolutely there still. I was absolutely obsessed with my baby, but it was mixed in with the physical pain, the feeling of like, I don't have a good handle on this. I'm not good at this. I didn't think it would be this difficult. Isn't it meant to be natural? Aren't you meant to just like fall into mother mode? And I'm not feeling that way. So, and then unfortunately for me, after a couple of months down the track, I actually experienced sort of those sort of dark thoughts of like, oh, if I was to do this or this happened to me, would that be so bad? Like, just really kind of starting to spiral around thinking about life and whether, is this what I want it to be? Just, going down a real bit of a rabbit hole. I didn't want to leave the house because I felt as though if I'm leaving the house, there's just so much to pack. I've got nap times. I'm trying to go by the book and they said that he needs to nap in 45 minutes time. So I need to be here to nap because I need to follow the book, and just all this additional pressure that I put on myself trying to tap into every resource I could. And, my type A was like, you can do this. You can get an A+ at this. You just need to focus, like read every book and every article. And so I think with all of this pressure and anxiety, I certainly did fall into having postnatal depression. My doctor did tell me, and I'd love your thoughts, Nicole, those who have experienced prenatal are more likely to experience postnatal. So I was a bit of a watch and see, and then that was me. And then the anger kicked in for me. So it was just this this journey of, I've got this, and then, oh, I'm pretty sure I've got this, and oh God, now I'm not feeling good, and now I almost want to tap out of all of this, and then hold on, now I'm just furious with everyone. So I'd love to know, I don't know, where do we even start? Yeah. Is it true that those who experience mental health challenges when they're pregnant are more susceptible postnatal?
Yes, it is. So rates of anxiety and depression do increase in the postnatal period. That's the first thing. We also know if you have a personal history, even before you are pregnant, of having depression or anxiety or a mental health condition, your likelihood of relapse or developing these conditions in the perinatal period is increased. So one of the key factors we ask when we're looking at someone's risk of developing a mental health problem at this life stage is about their past history. This is why as well, because it's so important that we screen all women for anxiety and depression, not just in the postnatal period, but also antenatally. One, it's common, but we want to get these conditions identified and treated before the baby arrives, because we know when the baby comes, there's a lot of other, as you just described, a lot of other factors and pressures, and which will only contribute to that burden. So the earlier we can identify it through screening antenatally as well as postnatally, the better.
So screening, and I know you mentioned this in the last episode, screening, doing the checklist. Can you talk to us, what does this look like?
So screening can happen in a couple of settings. So first of all, your health professional in your antenatal appointments and your maternal and child health nurse in your postnatal appointments should all be routinely screening. This is best practice. COPE is the developer of the Australian National Guidelines. They recommend universal routine screening. So just like we do ultrasounds and blood tests in pregnancy and postnatal checks, we also must be looking at mental health. So if you're not being asked about your mental health by being asked a whole series of questions to look at both your risk or likelihood of developing these conditions and the presence of symptoms now at the time of screening, you're not getting the best quality ante or postnatal care. So that's the first thing that I would regularly recommend. The other thing is, it's, of course, at the time of screening, it doesn't mean that everyone is going to be, if they're going to develop these conditions, they can occur at any time on that journey, but you might not be experiencing it at that time. So this is when it's very helpful to use the self-checks on the COPE website, thanks to the support of Tommy Tippia there, that you can actually check yourself out for a range of things: anxiety, stress, depression, birth trauma, postpartum rage. You can go in at any time and do those confidential anonymous self-checks, and importantly, get information and direction to pathways for support if you're experiencing these things.
Yeah, I love that. It's so good. Yeah, so important to know where to go. And to those listening, I will pop those details in the show notes so that you can access the self-checks if you feel you are wanting to. I mean, I feel like anyone should. Like, even if you're not feeling like crap like I did, just go check it out, because you might think you're fine. But, for me, as I mentioned in a previous episode, when I was pregnant, I felt like I was probably okay. It wasn't until my partner raised concern that I realised actually I wasn't. So, I mean, I think it's just a fantastic resource for us all. So I'd like to come to some audience questions. One of them I think is great, actually, not I think. It was a question around, how do I know if I've got postnatal anxiety, if I've got postnatal depression, or if I'm just having like a bad day and, maybe a couple of bad days. Can you explain to us the difference?
Yeah, sure. It's a great question, because everything comes on a continuum, right? We don't. It's not on or off. It's not like so. Basically, if we take it back a level to, well, what does anxiety feel like? I mean, we know what it's like when you're walking up the aisle or you have to get up and do a presentation and you feel those feelings of anxiety. So all that is like your flight or fight response, which is preparing your body for a situation. And that's what your body does to help you in those circumstances. But in the case of anxiety, people will experience those feelings without necessarily a scary or an event per se. And those feelings of anxiety can be overwhelming, difficult to manage. And when you're feeling those different symptoms, you then might start to think, well, I'm feeling anxious, so something must be wrong. So then you start having, you might start having worrying thoughts that something's going to go wrong. And it's also true that quite often that anxiety can lead to what we call scary thoughts or intrusive thoughts, where you suspect that something terrible might happen. And again, it is a symptom of anxiety, but sometimes people think they're going mad, and I don't want to talk about it. They don't want to mention it to their health professional because they think, well, they might remove my baby because I had a thought that something terrible was going to happen to the baby, or what if this knife on the kitchen bench hurt the baby? But it's not an intention to do anything. It's a reflection of anxiety. So that's what anxiety is. Depression, on the other hand, is when you're feeling very sad or down or finding it very difficult to get through the day. So everyone has good days and bad days. So typically we say once you've been experiencing those symptoms and it's impacting on your ability to function from day to day, and this is lasting 2 weeks or more, then it could be a sign of depression. So yes, there are, particularly in parenthood, there are good days and bad days, but if this is sustained and it's impacting on your quality of life and your ability to get through the day, again, check yourself out on the self-checks and just, identify that whether it's time to get help, because it could be an indication. The baby blues, or the just having a bad day, the baby blues is technically a condition we refer to in the first 5 to 7 days or so, or up to 10 days after having a baby, and that's where you might feel very overwhelmed and emotional, and that can often be in response to the sudden change in hormones following birth. But that generally subsides on its own and goes away. So generally we wouldn't diagnose depression or anxiety till after, say, 3 or 4 weeks after having the baby, but it is true also, as we've discussed earlier, that these conditions can obviously manifest in pregnancy and continue through to the postnatal period. So picking it up early in pregnancy is key, but at any time we want to identify these conditions as soon as possible.
How common are they? Is postnatal anxiety more common than postnatal? What's the?
Yes, it is. So we know from our screening data from over 200,000 women that anxiety is very common. We generally have the statistics that around, say, 1 in 7 women would experience depression postnatally, and around 1 in 10 antenatally. But the rates of anxiety, I would say, would be around 1 in 4, 1 in 5. And we are seeing that these rates postnatally are increasing over time. Comparing data to 20 years ago, there is increased rates of anxiety and depression, postnatally particularly. And I think that's a reflection of, society. In some ways we're more connected than ever, but the expectations and the pressures are greater than ever. And I think it's very important that we manage and aware of our expectations about what this experience is going to be like or should be like, because I think sometimes we do contribute to our own levels of anxiety and depression by putting unrealistic expectations on ourselves.
Yeah, for those of you who feel like when you're doing the scroll, you're constantly like, well, I'm not as good as them, or they've got a handle on it better than me. During times of, tough mental health situations, I just started muting people. Mm-hmm. Sorry, mate, you're out. I want to look at if I am scrolling, I want to look at the things that are going to make me laugh, or my friends enjoying themselves where I'm not getting triggered. Yeah. And so I guess that would be my little tip. If you're feeling like Insta is triggering you, just be super mindful of what you're taking in. And another thing I did was I muted the news. I just, at the time, I was like, literally, if I saw a baby, in poverty in a country, I would just break down into tears, and after having just had mine. So I was like, I just need to be super mindful of what I consume at this point in time. Do you find that? Is that something that you're also very big on?
Absolutely. And, being aware of those around you. Even parents groups and things, be mindful of those who are actually supportive versus those who are actually competitive. What's it really helpful for me? And, being very careful about, everyone wants to give you lots of advice, being aware of the impact that might be having on you and your confidence. And so it is a time where everyone is telling you what to do it and how to do it. You've got to believe in yourself and trust yourself. And that's where the Ready to Cope guide, as I mentioned before, is very helpful, just to help you realise, believe in yourself. You know your baby better than anyone else. And be mindful of the impacts of social media and often unwanted advice from others, and the impact that this might have on your emotional and mental health and your confidence as an expectant or new parent.
Absolutely. It reminds me of that Bluey episode, Run Your Own Race. I'm like, you just got to run your own race, babe. We've got this. So another one, we got a lot on this, Nicole, this particular topic. People saying that they experienced anger after having their newborn, not towards the child, just generally feeling that level of anger. And a lot of people were asking, is that the same as postnatal depression? Can we talk anger for a second?
Yeah, we can. We definitely can. So, look, some would say that anger can be a symptom of depression. I think we've spoken a little bit about how it's natural in this scenario to have feelings of resentment. Your whole life is put on hold. Your social connections are not there. Your sense of identity is being rocked. And then on top of that, you're having to give your needs. Your needs are coming down the list after the baby, often other children or then your partner. It's natural to understand why you might feel resentment and anger. Put on top of that scenarios where the baby's screaming, the baby is not sleeping, you've got sleep deprivation. Again, you're only a human being. It is understandable why you might be experiencing those feelings. It's like the match that is burnt right down. So for some people, they might collapse and, fall apart. For other people, it's just that frustration and resentment. And it's not towards the baby themselves necessarily. It's the situation as a whole. So it's really important if you ever do feel like that, just number one, know that you're not alone in that experience. Number two, this is where we would recommend strategies like putting the baby in a safe place, like in their cot or something like that, and then just going out and getting yourself some deep breathing to help manage that pent-up build-up of the rage and anger, and just don't be hard on yourself. Understand that your resources are so depleted that's leading you like this. You're not a bad person. You're not a bad parent. It is a situational response, and it's okay. And it's very important there to look at areas where you can look at nurturing and self-care so that your needs are being and you're filling your own cup so that you're not so depleted that you might, you find yourself getting to the end of your tether.
Yeah, I so hear you. I was just thinking, what did I do when I experienced the rage or that level of, as you said, it's a frustration. And I think for me, definitely when I moved my body, so whether it was going for a walk or doing, a home exercise or whatever it was during COVID as well when I had my baby. So that was an extra layer. Yeah. But, doing what I could just to move my body when I could hand the baby off, or if the baby was in the pram, off we go for a walk. Another thing for me, because I had the resentment towards my partner as a big one postnatally. So, and I kept going, I've got this. And I kept doing all the things and, and eventually the lid popped off one day as we're walking back I remember we had our baby with a babysitter at home and it was 5 to 12 and I was like, we're going to get back for the babysitter. And I remember I look over at my partner and he was just like nonchalantly like, oh, it's fine. We've got plenty of time. And I remember being like, your life hasn't even changed. Yeah. And I've got all of this that I'm dealing with, and it's just that fresh. And I remember as we walked, and then he looked at me and was like, oh, okay, we should leave. As we're walking home, I was like just furious. I'm like, my life's changed. Yours hasn't. Help me. And because I'd let it in, held it in for as long as I could, I wasn't even articulating how I was feeling very appropriately because he was just like, she's just lost it. And I'm like, no, it was a cry for help. So I guess for those listening from that experience, if you are feeling like you're just holding it all together and that you've got so many, things that you're trying to just manage, my biggest recommendation is before the lid pops off, speak to, if you're fortunate enough to have a partner or whoever's in your tribe, speak to them and start, having those conversations as to perhaps how you can balance the load that little bit better. Yeah. That certainly helped us. And actually, we had to go and see a third party. So we ended up going to see a relationship psychologist because I couldn't articulate. And he was just like, well, mate, I'm doing the best I can. Yeah. So we needed that third party support. Yeah. Do you see that a bit, I guess and how important is that communication piece?
Yeah, look, it's very important. And people talk a lot now about the mental load. Your life is suddenly you're thinking about things in sleep increments, feeding increments, nappy changes, everything, your whole mindset has changed. And sometimes for the other partner, it's that they don't even know what's in your mind. So absolutely, sharing the load, the mental load, the physical load, because if you don't, they've got no idea what's going on and then they can't help. So having those conversations and talking about when you're finding it frustrating as well so that you release the pressure before the pressure cooker explodes is a great idea. And then, and potentially that can prevent the need to have to go and have a third party because, you're expressing what's going on and not just trying to hold it all and keep it all together yourself and then that's what breeds the resentment sometime as well, which is understandable.
Yes, absolutely. Life kicks on, doesn't it?
It does.
How long does this postpartum period, last, I get, from your perspective? So those of us who may have 3 or 4 year olds and might be experiencing things, are we still going to cope? How does it work?
Yeah. So although, technically what we call the perinatal period starts from conception till 12 months after the baby's born, that's probably the most at-risk time. However, there's now more talk about, the first 1,000 days. And some studies that have been done have actually shown that they've actually done studies where they've looked at women with 4-year-olds and identified very high rates of postnatal depression. So it's never over. And sometimes that might have been at a mild with the first baby, but once the second baby came along or the third, that's the straw that breaks the camel's back. So this is why it is so important that we keep on top of things and identify things early and use prevention approaches rather than just take on more and more, which as mums and women we often do. It's about thinking and being proactive and not getting to that point. Technically it's 12 months, but of course not everyone's identified at that point, and we know other pressures continue to build, so it can occur at any time around this early parenthood time.
Yeah, love that. And yes, it's very relatable based on, just speaking to other parents too. It's such a, change in lifestyle and everything, and it can take a bit of adjustment, and it might not be just those first couple of months or the first year. It could go beyond. So for those of you who, may have toddlers or young children as well, beyond the newborn phase, just know to, as Nicole was saying, be mindful of your mental health. And if you're sort of questioning things, always best to, do the research and find a sort of some support for yourself. I'm curious, Nicole, so when it comes to the checklist, you mentioned Tommy Tippy had a big hand in being able to put some of those together. Just for those listening, can you give us an idea of those common topics that people can do as far as the checklist go?
Yeah, sure. So for those who might be struggling or know someone who might be struggling with infertility, we can look at anxiety, stress and depression during that phase. We then have anxiety, stress and depression during pregnancy and in the postnatal period as well. Birth trauma is another self-check. For those who are pregnant, we also have a check around a condition called hyperemesis, which is severe morning sickness, which has a significant impact not only on your physical health but also your mental health as well. So there's what we call, it's actually called the puke scale, but it's spelled Puque scale, not the other. But that can certainly help you identify when it might be time to go to hospital, for example, to get other fluids and other ways of sustaining your physical and mental health. And then we have the postpartum rage scale as well, which we've recently added, given, again, this is such a common but taboo topic that people often don't talk about. But people can check out, have I crossed the line and what might this be a result of and when is it time to get help?
Yeah, amazing. So good. So as I mentioned at the start of the app, guys, I'm going to drop all of the relevant links in the show notes. Nicole, to wrap, what is one message that you wish every parent could hear during postpartum? What comes to mind?
Yeah. Look, I, number one, think be very mindful of not comparing yourself with others and where you're getting your information from. Be careful when scrolling through social media. It's not necessarily reality. The other number one piece of advice I'd give to all expectant and new parents is to sign up to the Ready to Cope guide. It's a free weekly guide which will give you all the insights into the different challenges that can come up on the journey to becoming or being a parent. It'll just make you realise that you're not alone. It will help you with the challenges that you might not have seen coming or understand what someone else might be going through, and importantly direct you to quality information and also referral pathways at the time that you need it. So Ready to Cope is my number one recommendation for every expectant and new parent.
Yeah, I love that. Nicole, thank you so much for your time.
Thanks for having me.